It's the worst nightmare of every tourist. At noon, you're enjoying an expensive holiday in the wildlife parks of East Africa. By the small hours of the next morning, you're in agony.
Okay, I've copied. You have a very sick patient.
And that's when your tourist lodge calls AMREF, the African Medical and Research Foundation.
He is complaining of severe pain radiating from the chest to the left arm.
Okay, copy that. The patient has chest pain radiating to the arm. Confirm?
He is looking very sick and is vomiting.
Confirm you are at Ngorongoro Serena Lodge and you want us to come first thing in the morning, over?
Affirmative.
Down pain, yeah.
Small prick. Sorry.
Thanks to AMREF's flying doctor service and his insurance company, Luigi Lino will be in a Nairobi hospital well before 10 o'clock.
Just take some deep breaths for me. Some deep breath. Right.
Meanwhile, Luigi's in the competent hands of a locum doctor. AMREF has its own emergency medicine specialist, but she's otherwise engaged. The famous Kenya Safari Rally is on, and AMREF's providing the emergency medical cover. Hovering over the race for 3 days is AMREF's head of emergency services, Dr. Bettina Vedera. While the rally's on, the helicopter touches down only for brief refueling stops. But it's hardly a typical job for AMREF.
This is a very, very unusual thing we do. I mean, normally what we do is air rescue in medical emergencies for the local people, mainly. I mean, road traffic accidents make about 60% of our evacuations anyway.
This is a more familiar scene for Bettina Vedera.
Okay, just breathe in and out. Yeah, try as good as you can.
A Mutatu, one of Kenya's lethal bush taxis, has crashed in the middle of nowhere. 2 Kenyans and a Japanese backpacker are badly hurt.
Where do you feel pain? Here? Huh? Here?
She doesn't speak English.
Dr. Vedera was trained in emergency medicine in Germany, but she's never regretted her decision to come to Kenya.
You feel that each and every doctor who is working here is really, really needed. Or else I think in Europe, whether I would be there or 500 other people doing the same thing would probably not make a difference. And then you think, yeah, here you really do make a difference to people, probably. I hope so.
The fleet of modern aircraft, the ventilators and ECGs and infusion pumps are all a far cry from the way AMREF started 40 years ago. But the idea that doctors here make a real difference hasn't changed at all, since AMREF's founder took to the air back in 1957.
He is called Michael Wood, and his name will be remembered in Africa for many years.
Sir Michael Wood, farmer, amateur pilot, and plastic surgeon. It was his idea to use aircraft and HF radio to bring the big city surgeon's skills to the bush. He would fly for 3 hours, operate in a tiny bush hospital for 8, and then fly 3 hours home. But Wood soon realized that even his prodigious energy couldn't make much of a dent on Kenya's massive health problems. Prevention was better than cure.
One of the ways we do this is by going out to the bush and getting clinics going in the bush for preventive medicine.
And so he recruited Anne Sporry. Swiss origin, French nationality, farmer, doctor, pilot, adventurer, and one of the feistiest women you're likely to meet.
Where all the bloody Marseilles go? Oh, dear, dear, dear.
Anne Sporry was already in her 40s when she learned to fly and set up AMREF's first mobile clinics in the bush.
This
runway is absolutely impossible. There's no windsock again, and there are holes on the runway. Will you go and see the chief about it? Because
Yes, I'll do.
really and truly, it's impossible.
Michael Wood died in the 1980s, but Anne Sporry is still very much alive and kicking.
And I am very, very, very displeased. Okay? Thank you. Bastards. So, Kilda, you got the drugs?
Anne Sporry was 79 last birthday. Officially, she retired from AMREF years ago, but she still has an office at their headquarters in Nairobi, and she still ferries drugs and supplies from AMREF's pharmacy to clinics all over Kenya.
This is very, very important because eye problems are terrible there. Aspirin and aspirin. That's flagyl for diarrhea. And this is crate of disinfectants, which are so important now because of cholera and...
She pays for the drugs and the aviation fuel with money she raises herself.
Right. Well, thank you very much. You've written it all down.
And that means keeping on top of the paperwork.
Oh. I hate paperwork. And I'm not very good at it.
Is it growing on you?
It goes on me. I have to clear all that. I know exactly what all these papers are, and I've got to clear them, and of course things crop up, like you. So you can't always do what you plan to do. Hello? Yes? I'm arranging for having, to get the people ready to know that I'm coming and can do some diagnosis for them, etc. And we'll need some oil. We're going to this little village in the Rift Valley where I probably started treating the people in 1965, something like that, 66 probably.
At the village of Chamboli, they know she's on her way. A visit from the woman they call Mama Daktari is a big event. Some of the Maasai walk 20 kilometers to see her. At this time of year, the grass of the Rift Valley is normally dead and brown. But unseasonal rains have brought magnificent pasture for the cattle and plagues of malarial mosquitoes to torment the Maasai. These days, Anne Sporry always flies with her co-pilot, Eric. Even though she trained him, she still prefers to fly herself.
I was 45 when I learned to fly. It was a new dimension. And the freedom I still have now, being able to get in my plane, it really is fantastic. The whole of Africa is yours.
Among the waiting patients at Chamboli and all over Kenya are people who've been treated by Dr. Sporry for 30 years. Dr. Sporry had the airstrip at Chamboli cleared back in the 1960s.
The strip is a natural pan that doesn't grow anything. And we had to take all the stones out and level it nicely. And now it stays like that. It's absolutely incredible how useful it is.
But according to AMREF's chief pilot, few people could take a 20-year-old Piper Cherokee into a strip like this.
Nobody can fly that aircraft like her, because we have some very short airfield, and none of us would try what she's doing in her aircraft. She does it with experience, lots of experience.
Wait a minute. The sun is going to come where? Jumbo.
Dr. Sporry has lots of experience too in setting up a clinic under a tree. You need 2 folding chairs, a stiffened sheet of cardboard, a box of drugs, and a good strong dose of authority.
Where is... You're not doing your job.
They are now seated.
No, but look at all these. Can I see anything there? Can you please all go out? The Maasai will never make a line. They will always crowd. And some of the people, the nomads in the north, are much, much more disciplined. They will make a line. They just wait. How old is he?
13 years old.
He's got a fever, yes. So when did he start being sick?
Started yesterday.
Yesterday?
Yes, sir.
Malaria, dysentery, diarrhea, the children, quite often anemia due to worms. And one of the real plagues here are the trachoma, this conjunctivitis, which is very, very persistent and finally wears away the cornea and people become blind. I can see she's got a cataract. She's nearly blind. Yes.
Old Mother Kalama has been waiting over an hour for her turn.
She's definitely got chronic arthritis of the hip, of the right hip. She's got a cataract of the right eye. You can see it very well. I mean, it's completely white. If she could be taken to Kikuyu Hospital, they operate there for nothing, and very nearly nothing, and they are very, very good. How long has she been sick?
For 1 week now.
1 week.
While Dr. Sporry is dealing with her penniless patients in Maasai land, Dr. Vadera is 200 kilometers away in Tanzania.
1, 2, 3, up. Careful.
A wealthy heart attack victim is being airlifted by AMREF to Nairobi. Emergency evacuations are only a small part of AMREF's operations.
So then, when did the pain disappear again?
After 2 days after taking the pills.
Primary healthcare, medical education and the outreach programs started by Michael Wood and Anne Sporry are all going strong.
Oh.
But evacuations like this are undoubtedly expensive. In a country racked by AIDS and cholera and Rift Valley fever, should AMREF really be spending its money on wealthy heart attack patients and tourists with tummy ache? But according to Dr. Vadera, her department doesn't spend money, it makes it.
The emergency services, they raise money through memberships. So by people subscribing to us and paying membership fees, obviously not everybody is going to be rescued. So a lot of the membership money goes towards the outreach programs, paying for it.
Some money.
These days, both Bettina Vadera and Anne Sporry are exceptions at AMREF. Not because they're women, but because they're white.
Most of the medical staff now are Kenyan, aren't they? But
oh yes, but most of the staff in general.
But you get the occasional expatriate coming in, like Dr. Bettina Vadera.
Yes.
Does she sort of remind you of you when you were young?
In a way, yes, I'm sure. Well, she's doing very much a similar work. Bettina really reminds me very much of the days when, and they're ready to go and doing a lot of things. I'm keeping up things rather than starting new ones.
So far, Anne Sporry is keeping things up remarkably well. For her trusty co-pilot Eric and for her passengers, flying with Mama Daktari is always an interesting experience. Sometime soon, someone might decide that she's not fit enough to fly. But AMREF's chief pilot doesn't like to think about that.
I don't know, she will have to try to find something else to do, but I don't think it will be easy. Not easy.
It's her life.
Yeah, I think it's her life.
Has anyone tried up to now?
No, you want to.
Well, no, I didn't. Suggesting to Dr. Sporry that she might be too old to fly struck me as foolhardy beyond the call of duty. Besides, it plainly isn't true. Mama Dakhtari won't be stopping for a long time yet. And even when she does, the doctors of Amref will keep on flying.
Thank you.